What's going on, everyone? Welcome back to my channel. In today's video, we're going to look at rehab exercises for low back or lumbar disc herniations. So if you've been diagnosed with a disc herniation or a disc bulge, or you have radiating nerve pain that goes down the back or front of one leg, then you'll want to stay tuned for today's exercises. Before I get into today's video, I just want to point out that my new book is out. It's called Rehab Science. It's available on Amazon. The book covers the 50 most common problems that affect people in terms of what they come into physical therapy for. It has comprehensive programs that guide you through 3 phases of rehab, and I have in the low back section a low back disc bulge and herniation rehab program. So if you're looking for a comprehensive sort of injury encyclopedia with programs that you can do at home, please check out my book. I'll put a link down in the description for the book in Amazon. All right, so let's jump into the exercises. So with low back disc herniations, like I mentioned, they typically cause back pain and radiating nerve pain into one leg. We call this lumbar radiculopathy, or it's called radicular pain. When people have these types of symptoms, we notice that they usually have a directional preference in terms of the low back. And that means that they have one direction of movement, either flexion or extension, that makes their nerve pain better. So that's really important to figure out in the beginning of your rehab process. I'm going to show 2 movements. You want to pick the one that helps get rid of your symptoms. And the way you'll notice that is that the nerve pain starts to leave your leg and move up towards your spine. If the nerve pain moves towards your spine, that's called centralization. It means the nerve is getting better. If you do a different movement and you notice that the nerve pain travels farther down your leg, that's called peripheralization, and it means the nerve's getting more irritated and you want to avoid those types of things. Okay, so you're going to test these first 2 movements, see which one causes centralization. So the first one is lumbar extension. For this one, you can start just laying on your stomach. When we lay on our stomach, our low back goes into extension, and for some people, this makes their nerve pain get better. So you can kind of start here, see what happens. You can also, if that's, pretty easy, you can go up on your forearms and kind of prop up on your forearms and get a little more extension. You can hold it here. You can also just kind of go up and down. I'll usually have people hold for a few seconds, go back down, and then come back up. We call these repeated extensions. So you're just kind of going up and down like that and taking your spine through extension. As things get more mobile and it gets easier, as things calm down, you can push up, a little bit more and arch more. So basically first just try extension maybe here on your forearms and see if that helps your nerve. If it makes your nerve worse, if you notice your pain getting worse, then what I want you to do is try flexion. So the easiest way to do flexion is to lay on your back and pull your knees up to your chest. So when we flex our hips like this, it also rounds and flexes our lumbar spine. And for some people with disc herniations and nerve radiculopathy, this is helpful. In other people, it can make them worse. So you've just got to figure out in the beginning of rehab which of these 2 movements, either lumbar extension or lumbar flexion, which one helps your pain the most, and stick with that in the beginning. Both of these, when you find out the one that helps you the most, you can do it every day. You could go through these movements several times a day. You could do, maybe 3 to 5 sessions of this a day, and you could do 5 to 15 repetitions. Just kind of figure out what works best for your body and your symptoms, okay? So that's the first part, a lumbar flexion or extension mobility drill. Find the one that helps you the most. For the next exercise, we're going to do a sciatic nerve mobilization. Sometimes this is called nerve flossing. They're basically techniques to help our nerves slide and glide, and they can help improve blood flow to the nerve. So just do it on whichever leg you have your symptoms. What you're going to do is lay on your back, and I'm going to work on my right leg, so I'm going to put my left leg out straight. I'm going to grab behind my knee here and hold with my hands, and then when I straighten my knee, it's going to put my sciatic nerve on tension and can cause pain. So just be careful with this. Basically, we're going to alternate putting the nerve on tension and then putting it in a relaxed state. So when I straighten my knee, that's going to put the nerve on tension, like I said. When I do that, I'm going to point my foot. So now the nerve's on tension at my knee, but it's in a relaxed position at my ankle. And then when I bend my knee and put the nerve on slack at the knee, I'm going to pull my ankle back into dorsiflexion to tension there. So I'm just going to alternate. So I'm going to go back and forth like this. Knee bend, ankle up, knee straight, ankle pointed. I'm going to go back and forth between those two to help mobilize that sciatic nerve. Now, as this gets easier, what you can do is you can play with different variations. You can bring your leg up to where it's tight and you can just pump your ankle back and forth like this. This will be kind of a more intense version, but another way to mobilize that sciatic nerve. Typically, we'll tell people to do 10 to 15 repetitions and then take a break. And this is, again, an exercise that you can do several times throughout the day to help improve nerve health and reduce nerve pain. Okay, so that's our second exercise, a sciatic nerve mobilization. For the last exercise here, we're gonna stretch the glute muscles and some of the deep hip rotator muscles. The sciatic nerve runs right through our buttock region near a lot of these muscles. So I find that with a lot of patients, if they stretch these muscles, it helps to reduce sciatica type symptoms. So for this one, again, I'm gonna work on my right leg. What you're gonna do is bring your knee, your hip up, and bring your knee across to your opposite shoulder. So pull it with your hands. You're trying not to rotate your back, okay? So keep your back flat on the ground, keep your pelvis on the ground, and pull your knee across until you feel a stretch here in kind of the side of the leg in the buttock region. Again, the sciatic nerve exits our back and goes down through here, down through our hamstrings. So stretching these muscles often really helps reduce discomfort in the hip and in the low back regions, and can help reduce nerve-related pain. Okay, so for this one, you can do it every day again, 2 to 4 repetitions, and hold each one for 15 to 30 seconds. When you're done, just give it a little break. It doesn't hurt to do the other side, but you can just kind of set it down, give it a break, and then bring it back up and kind of stretch again. You can spread these stretches throughout the day. Oftentimes that's the most helpful when you have pain, is just to do them kind of intermittently throughout the day. Okay guys, so those are 3 exercises that I find to help most people with low back, disc herniation, and disc bulges that cause radiating nerve pain into one leg. They're kind of more acute type exercises when your pain's more severe. There's of course other mobility and strengthening exercises we would do in the later stages of rehab. I have other videos on those things if you need help in that way. Also, again, the book takes you through 3 phases of rehab and would guide you through this whole process. So if you have any questions about anything, this video, my new book, any of that stuff, just put it in the comment section and I will get back to you, and I'll see you guys in the next video. Bye.